because we are facing issues.
Yes, sir.
Okay.
Yes, sir. We can go live.
Okay, thank you. So Gajendra, you can start now. We can start the program. We are live.
Okay, sir. So a very good afternoon, all the animals doctor. Thank you so much for the joining us for today webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an initiative from Kerala Pharma through its innovations to serve the society and humankind. The topic of this webinar is novel 3-dose G protein vaccine, ultimate key for compliance. Dear doctor, rabies is the world's first 3-dose anti-rabies vaccine, and with great pride we would like to inform you that rabies has successfully completed 1 year of launch, with more than 40,000 animals and victims begin vaccinated, 100% compliance reported, and no case of was registered. With this, my honor to introduce you to the speakers of today's webinar, Dr. K.R. Singh, MBBS MD, last working with Sai Hospital and now currently working with MDA and Buddhi Vihar. So now I am hand over the session to Dr. K.R. Singh.
Very good afternoon, all of you. Today I am discussing about the novel 3-dose glycoprotein vaccine, ultimate key for compliance. Next slide, please. Please change the slide. Globally, 59,000 human deaths annually occurring, highest in India, which is around 20,000 human deaths in a year from rabies, accounting for 60% in Asian deaths and 35% globally. 91% death in India occurred in rural areas. Change slide, please. Please change the slides. Current management of rabies. It included 3 parts. Local wound treatment, that is first aid. Second one is active immunization, that is vaccination. And third one is the passive immunization by rabies immunoglobulins. As we all of know that in previous scenario, all of you using 5-dose regime with intramuscular route. Vaccination depends upon the severity of the bite. If the bite is category 1 and category 2 without invasion of the skin or with intact skin, so there is no need for rabies immunoglobulin. In category 3 bites, when skin is not intact or there is a piercing of the legs or abrasion or laceration, then it also needed rabies immunization immunoglobulin along with the vaccination. In local wound treatment, that is the most important part of the treatment. We thoroughly wash the wound with underwater tape and with spirit and soap also, along with 5 to 7 days course of antibiotics to reduce the chance of infection of gram-positive and anaerobic infection, like amoxicillin clavulanic acid for 5 to 7 days. Change the slide. Current challenges for the post-exposure vaccination or prophylaxis. One is the non-compliance. Current rabies vaccine are cell culture vaccine Inactivated vaccine are 50-year-old technology. It is inconsistency in potency, stability, availability, and adverse events. Change the slide. Anti-rabies vaccine. Compliant means who receive the full course of anti-rabies vaccination, that is scheduled doses of anti-rabies vaccination on recommended dates. Delayed compliance means who completed the scheduled dose of anti-rabies vaccination within 60 days but deviated from the scheduled regime. Dropout or non-compliant means who had taken at least one dose of anti-rabies vaccination after animal bite but not completed all the scheduled doses. Change the slide. Rabies post-exposure prophylaxis in routine practice. A study done at travel clinics in which total 110 patients who received rabies vaccination 4 doses. Shortcoming in the management of these patients were late initiation of the post-exposure prophylaxis in travelers, administration of human rabies immunoglobulin. Third one is the antibody level titer less than 0.5 international unit per animal in 6 of 90%, that is around 7% after 4 doses of vaccine. Conclusion your study patients do not always receive optimal rabies post-exposure prophylaxis under real-time conditions. A significant proportion of patients did not develop adequate antibody level after 4 doses of vaccination. Change the slide. Non-compliance due to 5 doses vaccination and causes of death. Most of cases causes of death in rabies was rabies encephalitis, or the reason for death may be due to lack of administration of rabies immunoglobulin or poor compliance to the vaccination. Change the slide, please. Another study by Mansi Panda and Riz Kapoor for compliance to post-exposure prophylaxis among animal bites, a hospital-based epidemiological study in Safdarjung Hospital, New Delhi, in which 360 animal bite patients were included. Pre-designed, pre-tested structural questionnaire was administered by the technique. In the study, 53% were non-compliant to the full course of anti-rabies vaccination. Change the slide. Another study for the compliance by Ravish, Hardwali, Sankaraya et al., in which the compliance rate for the intramuscular rabies vaccination was only 60%. It was 5 dose schedule. Change the slide. Constant for the compliance to complete course of anti-rabies vaccination. One is the interfere with the school timing in younger children. Distance for the hospital, it includes also 11%. Cost, around 30%. Forgotten the dates, around 18%. Of wages, around 47%. The major constraint for the compliance to complete anti-rabies vaccination was loss of wages, around 47%. Change the slide. There are two types of vaccination, which is nervous system drive or cell-based drive. In nervous system drive, live activated vaccination and inactivated brain drive vaccination, or in cell culture vaccination. ठीक है, change the slide. Now, meeting the unmet medical need. Introducing a novel vaccine with simple and shorter regime, that is 3-dose regime, by rabies glycoprotein vaccine, in which we give 3 doses of vaccination by intramuscular route on 0, 3, and 7 days. In which 0 means a first day of the vaccination, not the bite of the day. Change the slide. It's about the by which the vaccination is developed, which is PLP technology, not necessary for us. Change the slide, please. In clinical phase 2 trial of vaccination, there was around near 100% of seroprotection after 42 days of vaccination by the third 3 doses of vaccination, and is similar to the 5-dose vaccination. Change the slide, please.
We are not
Change the
able to
slide.
hearing. Has some network issue.
Our slide is not showing here. Please check.
Something the technical report is here.
Hello, support team.
Change this
No?
one.
Sir, screen is visible, sir.
Yeah, visible now.
Now it is okay, sir.
Okay, okay.
Change this one. Clinical study phase 3. Safety and immunogenicity of novel 3-dose recombinant nanoparticle rabies glycoprotein vaccine administered as simulated post-exposure immunization or randomized comparison controlled multicenter phase 3 clinical study. ठीक है, चलिए. In this study, we included around 800 patients with 2:1 randomization to evaluate the immunogenicity and safety of rabies G protein vaccination. ठीक है. Comparison with the substance vaccination. Result of the study are consistent across different parts at different stages and net. It was noticed that it is not inferiority for seroproduction and primary endpoint at 40 and 42 days were met. In point of safety point of view, localized side effects were very less like localized pain, redness, swelling are very much lesser than the previous vaccination. And along with the systemic adverse event are very much less to the previous vaccination. That is fever, ear pain, headache, joint pain. Although urticaria was little bit higher in this three-dose vaccination, it's not clinically significant or statistically significant. ठीक है, change the slide. स्टडी का कंक्लूजन था तो novel three dose was known inferior to reference vaccine. Lesser adverse event compared to the reference vaccine. Novel three dose was found to be safe and immunogenic and was comparable to five doses vaccination of the version pre-qualified vaccine. Change the slide. Three dose vaccination award is for various award. Seen in the screen. Change the slide. Thank you. Thank you very much, listeners.
Thank you so much for Dr. Yasmin for the initiative talks. We are truly appreciate your efforts. But not the least, we would like to report that we had won the prestigious award in innovative category, India Pharma Award and Golden Globe Tiger Awards. So once again, thank you for Dr. Yasmin and thank you all participants in this meeting. Roman sir, can you say something in this meeting?
Thank you so much, sir, for giving your valuable time. And I also thank all the participants who have spared their time to join you. And all the slides were very much clear and it was very well explained by you. Sir, few questions are there, which I would like you to address. First, very common question which has been asked by many people, that if somebody is suffering from rabies, what will be the initial symptoms? Rabies के symptoms क्या होंगे? एक ये question बहुत commonly पूछा जाता है.
Prodromal symptom are initial symptom like fever, body ache, malaise, fatigue, and headache. These are the most common symptoms, which is starting in the 7 to 10 days of the disease. After 7 to 10 days, headache and vomiting and loss of sensorium or altered behavior, psychosis are there. And high suspicion of the diagnosis disease is key for the diagnosis. If we have the history of dog bite, rabies, along with the hydrophobia, which is the main sign for the disease.
Sir, just your experience also, now from 5 doses we have come to 3 doses. So ऐसा कोई आपके जान में ऐसा कोई experience है जिसमें you have seen that patient don't come? मतलब 3 डोज के बाद जैसा हम लोग स्लाइड्स में भी शेयर करते हैं, it has been recorded also, studies also that कि 5 dose like 5th dose तक पहुंचते पहुंचते most of the patient they don't come back. तो आफ्टर दैट ऑल्सो कोई सिम्टम्स दिखते हैं? ऐसा हुआ है कभी कि 3 डोज के बाद पेशेंट ने 5 डोज का कोर्स कंप्लीट नहीं किया, बाद में आफ्टर 6 मंथ्स दे आर गेटिंग बैक द सिम्टम्स ऑफ रेबीज? सो ऐसा कोई एक्सपीरियंस आपने किया या फिर ऐसी चीज इज इट पॉसिबल कि सिम्टम्स 3 डोज के बाद अगर आप कोर्स कंप्लीट नहीं करते हैं तो वो चीज इट कम्स बैक? तो वैसा कुछ एक्सपीरियंस है सर आपका?
इन क्लिनिकल प्रैक्टिस में तो हम लोगों को नहीं देखने को मिला है ये चीज.
ओके. And okay, sir, fine. Sir, Suman sir, any closing call from your end? Sir, Suman sir, mute. Yes, sir.
Thank you, sir. Thank you, Dr. K.R. Singh and all participants. Thank you, sir, giving our valuable time, sir. Thank you, all of you, sir, and support team and PMTC.
Thank you, sir. Thank you so much for giving your valuable time. Tech support team, we can end the session. We can stop the streaming now. Yes, you can end the session.